Jane, just to start off with, could you tell us a little bit about what you teach and what sort of situations might arise and
Yeah,
cause
sure.
students grief?
Yeah, so I teach into the medical sonography course. I work out of the Brisbane campus, but the course is delivered over 5 different campuses. So unfortunately, I don't get to see all our students face to face. I've taught a few different types of units, anything from like the fundamentals of ultrasound into our first years to our clinical units. I used to be a clinical academic, and I've also done unit coordinating for our scanning skills labs. And yeah, so I think I've seen almost everything in this course has to offer these days.
What sort of things might arise that cause the students grief in terms of their anxiety?
Oh, so for on-campus type things, our labs tend to cause a fair bit of anxiety amongst the students because it's very much, I liken it to a driving test. So if anyone can remember what it was like to be 17 or 18, learning how to drive and stalling it as you're doing a hill start and that type of thing, and then having someone watch you actually drive, that's the type of, I guess, anxiety that sort of comes around our labs because it's very much a psychomotor skill, and it's a big cognitive load. So the students are armed with an awful lot of background knowledge and a lot of tips and tricks about how to scan things. But when you're learning how to scan, and it's also like learning how to drive, there's no one formula. So we can't say do A, B, C, and you'll get the result. You'll do A and B, but C is not going to work in this situation. So you've got to try F, G, Z, or V to get to the same result. And so they're going to be having to be pulling out all these problem-solving type things on the fly.
Then how do students react then? So when you can tell, how do you know that somebody is really feeling highly anxious about the situation?
So I always go into those tests knowing that 100% of students will be feeling a reasonable amount of anxiety on that day, because I remember my skills test myself and it was 20 years ago and I remember it like it was yesterday. So I can have a bit of an idea about what most people are feeling. I think when we get some students that are coping with that perhaps not as well, they tend to go very quiet. And then we have had a few occasions where they're actually not able to do anything. And so they'll actually stop talking and they'll actually stop even doing what they're supposed to be doing. So it becomes very obvious in the very extreme cases. But I think because we all, when we go into these skills tests, we all know that the student's going to be feeling some sort of anxiety. The staff try to put people at ease as much as we possibly can. And then it's just a matter of being able to read the room. And because you've probably got, say, 20 people in a foyer waiting to come in to have their testing and things like that, I guess you just have to be on your toes and see the signs. And certainly I've been doing this about 6 years now. The signs are easier to see. Dealing with it has become a little bit easier, but I would never say that it's anything. I don't want this for the students. No one does. And you certainly don't want them seeing them very distressed. It's awful. And I've seen 1 or 2 cases of where it's really devastating. But yeah, I guess it's just about sort of, trying to read the room. And if you can really notice that a student's in a really bad place, it's probably, I try to talk to them at the spot and maybe move them away from everyone else, and talk to them quietly and calmly and things like that. But it's happened a few times.
So what advice, I guess, Jane, would you be able to offer to other academics who might see the same things or experience the same things, similar things that you've done? What advice would you give them?
I would say to really lean on the counselling services. Coming as a newer academic, I feel like I've got a little bit of experience now, so I'm very happy to talk to counselling and just ask them for advice, very randomly. So it's really important to know that they're there to support us, support the students, I think. And probably something that I've learned about myself over the years as well is you do, as you were talking about, Kate, about boundaries. I think it's really important to know your boundaries because it can be I guess for different personality types, you can take on some of the students' anxiety yourself. And so it's really important to look after yourself. It's like that old, take the oxygen for yourself before you help someone else on the plane. It's totally translatable to this particular situation. So really know your own boundaries and know that students will go through anxiety. There's no doubt about it. But we do need to rely on other people to help us to help them as well, I think. Otherwise, I'd be going back to uni and do a psychology degree, and I don't think I've got time. I'd love to, because I think it's all fascinating. And I think that's why I really love, talking to the counsellors and think they're amazing people. But yes, they've definitely got their specialty, and I'm happy to point out students in that direction as well.
You mentioned that there is somebody in the team who's a mental health first aid responder.
Yes.
So what's the role, do you think, Jane? Is there a role for training staff in mental health first aid training, or any other kind of professional development, whether it's responding to students in distress or, whatever?
I think that's really valuable. I've done, I'm just trying to think off the top of my head. I've done one of the first aids, mental health first aids, which I found was very beneficial around asking people straight out whether, they want to hurt themselves or whether they're thinking about suicide or things like that. And that's really confronting, but now I'm really not afraid to use it if I've found myself in that situation. It makes you feel a little bit more confident that the next situation that you might find yourself in, you've got a few more tools, I guess, in your toolbox before perhaps you do need to. I mean, the most serious end of the spectrum, I guess, is calling the ambulance. But if you can sort of not get it to that point, and any tools that we can use is very valuable. And even if it's just something to get us to the point where we can then get that student to a counsellor, rather than going, all the way to the other side where, they might end up in an emergency department, which I guess has to happen in certain cases. But if we can avoid it and keep that anxiety a little bit more under control before it blows out, would be great.